Hey, I'm Michaela Davis, and I'm doing my informative speech on postpartum infection, and this is my audience. Okay, so I'm going to talk today about postpartum infection. How common do you think that it is for a woman to get some type of infection in the postpartum period? It's actually pretty common, and it's more common than more people think. Many women don't realize the severity or the frequency of these types of infections, so I think that the more information provided beforehand just kind of helps with preventing. There are many risk factors that increase the mortality of infections. I think today, with the little time spent in the hospital, now women are only required to spend 24 hours in the hospital, so infection is not likely to show up that early. Actually, 94% of the infections were after discharge. Normal pains for women can be misdiagnosed early. People have different types and ways of dealing with their pain and show pain differently. I work on a postpartum unit, so I see lots of different infections and deal with them on a daily basis. Some types of infections are mastitis, endometriitis, laceration, episiotomy infections, urinary tract infections. So some types, the mastitis it's a breast infection. It's from not emptying the breast enough or not wearing a supportive bra if you're not wanting to breastfeed. Endometriitis is if the placenta has not all the way been delivered, or if any bacteria got in the vaginal canal. Also, urinary tract infections are super common in pregnancy and just for women in general with the shorter urethra. And then laceration, episiotomy, that's just from the doctor suturing it, and it just gets bacteria in there as well. Some preventative measures they do now are taking the antiseptic shower the day of the surgery, using the chlorhexidine to prepare the skin, and then removing the hair with clippers rather than a razor before delivery. Some risk factors. Prolonged rupture of membranes, which is just how long your water being broke basically for a long time. Internal fetal monitoring, which is a way to monitor the baby. Multiple vaginal exams, which is just being checked too often. Lower socioeconomic group, which is just homeless, don't have access to clean water, clean supplies. Not emptying breast enough, which is mastitis like we talked about. Some signs and symptoms are just basic for all infections: fever greater than 100.4, chills, headache, loss of appetite, pain. Usually it's localized, so if it was mastitis, it would be strictly breast pain, and then increased heart rate. Some treatment or medications, it would be antibiotics. It's just standard usually for all infections, antibiotics and antipyretics like Tylenol, NSAIDs, which would be Motrin for inflammation, IV fluids. You want to flush everything out, and just fluids by mouth to just flush the kidneys and rid of that bacteria. And then pumping and emptying of your breast often. And lab tests and blood cultures you would want to do those before any of it to see what kind of bacteria was shown and if it was resistant to a certain antibiotic or what type of bacteria it was, so you would need to change the antibiotic or anything. So I've talked to you about the most common infections after birth, signs and symptoms, the risks, the preventative measures. I hope that I've taught you a little bit. And infections can take several days to show up, and different people they just show up differently in all people. They can just vary due to the type of delivery. Women have different pain tolerances, so it just varies from person to person. And it's just important as nurses and as a mother going to deliver to kind of be in the know about everything and know what to expect, and to be able to monitor for these things and be able to report it to the doctor. Thank y'all for listening, and I hope y'all have a great day.